Assalamu alaikum. This is Nawaf Salah, and I am a six-year medical student from Jamiat al-Marifa. 2 months from now, I will be graduating from my university, and inshallah. And before I graduate, I wanted to make a quick video on how to come up with a research idea in a simple yet straightforward manner. And instead of making a PowerPoint slide, instead of me showing you how to do it the boring scientific way, I sought to show you a way in coming up with a research idea the relatable way, in a relatable manner. And of course, I will explain this in English so that everybody in this audience could understand. All right? لا تخافوا الإنجليزي حقتي ممتازة بس عشان أوجه الرسالة للجميع. طيب. So to come up with a research idea, obviously one of the problems is making sure it's validated. يعني haram it's that somebody can come up with a research idea, he writes the research with a team, he has a consultant, and at the end of it he faces a roadblock. That roadblock could be difficulties in data collection or data analysis or IRB or even publication in a journal. So we want to avoid these roadblocks and making sure that your research idea, it's there, it's validated, and you can definitely publish it. It's not guaranteed, but there's a realistic chance, all right, if you work hard for it. So in this board, this is my blueprint, all right? This is my blueprint, my step-by-step process in making sure my research idea is validated. So before I come and talk about my step-by-step process, I will tell you 3 examples, not from my head, but 3 examples from the past in which I came up with a research idea. I did a research, and alhamdulillah, I will publish this research whether this year or next year. 3 examples, and they're very relatable, and I hope by the end of this video, you'll be able to come up with your own research idea following my examples and following this step-by-step process, all right? فخلينا نبدأ بالترتيب. Let's start in proper order, all right? So first, let's come up with a research idea before this. So whenever I come up with a research idea, it's not something that comes out of my head, out of nowhere. Typically, any research idea that I come up with, it is something that I encountered in my life, whether during my day-to-day life or as a medical student. So example number 1, when I was a medical student, 5th year, I had an ER rotation in a certain hospital, okay? And in this ER rotation, I noticed that there were an ER consultant. One ER consultant was having an argument with a nephrology consultant or with a radiology consultant. And what they were having an argument about, they were having an argument about a patient who had signs and symptoms of stroke, as well as chronic kidney disease as past medical history, okay? This patient, he had previous symptoms of stroke, and he has past history of chronic kidney disease, all right? The ER consultant, he wants to do for this patient CT with contrast in order to diagnose and confirm for stroke, as well as localize the type of stroke, صح? But the other consultant, the nephrology or the radiology, they are disagreeing with the opinion of the ER consultant. They say that giving contrast, the contrast that is used in CT scan, they say that whenever you're giving contrast, it will lead to acute kidney injury. So they're saying, no. We don't want to give contrast for this patient. He has chronic kidney disease, so it will exacerbate the issue. It will lead to more damage to the kidney by using contrast. Now, you tell me, do you think it is advisable not to do CT without contrast in a patient who has signs and symptoms of stroke? No, of course not. You have to give the patient CT with contrast because the brain, it is more important than the kidney. Yes, he has chronic kidney disease, but so what? Give the patient contrast, solve the issue of stroke, treat it, then you can come and deal with the problem of acute kidney injury. So there was this argument in the hospital, and there was this argument on the internet. The nephrology tells you there is contrast acute kidney injury. The radiology tells you no. The ER, he doesn't know, all right? So there is a contradiction. Somebody's telling you contrast, leads to acute kidney injury. So what did I do? Idea. That's what I did. I had a research idea. So I had this research idea that I wanted to know, does the IV administration of contrast in CT scan or coronary angiogram, does it lead directly to acute kidney injury or not? Okay? So this is my research question, my research idea. I presented it to a consultant in radiology. She said, this is a good idea. And I said, okay, this is my research idea. Now I want to validate it. So if you notice, this is a research idea that came to me naturally. This is something that came to me while I was reading the internet. This came to me during my ER rotation. And I asked so many consultants, and every consultant has a different answer from the other. So I made a research about this. So now that I have an idea, I want to validate it. This is the step-by-step process in validating my research idea. So I went on Google Scholar, and in Google Scholar, I typed the topic of my research idea, or I wrote it in a question. What is the effect of IV administration of contrast on kidney function? Or does contrast lead to acute kidney injury? So I wrote it as a question or as an idea on Google Scholar, and I focused on the articles from 2023 and 2024 because I wanted updated information, all right? I also found some guidelines. I also wanted to read guidelines, right? Because the guidelines, they all summarize the articles marra wahda. So as an exception, I also included the radiology guidelines from 2020, okay? But otherwise, articles from 2023 and 2024. So I gathered up to like 10 to 15 articles, all right? I gathered 10 to 15 articles, and I read every single one of them from A to Z. But in each article, I focused specifically in the limitations, the recommendations, and the conclusion. So I read it completely, but I focused on these three aspects, the limitation and the recommendation that you find at the end of discussion. And if you don't find it in discussion, you'll definitely find it in conclusion. And what did I gather? What is the summary? The summary is that I found that there is no direct evidence that giving IV contrast leads to acute kidney injury in adults. And there is no direct evidence that giving IV contrast leads to acute kidney injury in pediatrics. There is no direct evidence. At the same time, خلي بالك, at the same time, there was no direct evidence that giving IV contrast does not lead to acute kidney injury. So to summarize in 3 words, we don't know. We have no direct evidence. And what do I mean direct evidence? There was no clinical trial. There was no prospective study about administration of IV contrast leading to acute kidney injury. In fact, people assumed that contrast led to acute kidney injury. They assumed this is a thing because they relied on studies from the 1950s and 1960s, where back then, contrast, when it was invented, it was heavy. It was very heavy, and it very easily led to acute kidney injury. But the contrast in 1950 is not the same as contrast in 2024. There is no research that tells you that contrast truly leads to acute kidney injury directly. So nobody did a clinical trial, nobody did a prospective study about this. This is the limitation, and at the same time, this is the recommendation from so many studies that I read, because a lot of the studies, they were cohort studies, all right, and case reports. So what did I decide in the end? I decided that in the last step, I will do this research. I want to do research about contrast-associated acute kidney injury. Is it real or is it fake? Okay? So me as Nawaf, I had 2 options for the study design. I could make a prospective study. I could make a clinical trial about this, but me as a student, I found this difficult, okay? So this is option 1. Option 2, I turn it into a narrative review or a literature review. I will write a review about this topic and I will inform my audience about this issue. My ER consultant, my nephrology, my radiology. Remember, there is no evidence about contrast leading to acute kidney injury. So please remember this fact, and please remember we need prospective studies. We need clinical trials about this to truly confirm, because people that have acute kidney injury after receiving contrast, it does not necessarily have to be contrast itself. It could be sepsis, it could be diabetes, it could be hypertension that the patient already has. Okay? So I could not do clinical trial. As a student, it would be difficult. But I decided that a literature review is appropriate for this topic. So we did a literature review about contrast-induced acute kidney injury in pediatric population. And inshallah, we will publish this article by next year, all right, to a specific journal. This is one research that I am working on and how I came up with a research idea. And I made sure it's validated by following these steps. Have you noticed something? These are ideas that came from what I encountered and I discussed with a consultant and I made sure it's validated. All right? Let me give you another idea, another example. Example number 2. For example, prostate cancer. As a student, I took an elective rotation in family medicine 2 years ago. All right? And when I asked the residents, there was a time in my family medicine rotation in a center, I asked one of the residents, do they screen for prostate cancer or not? Because it's common in elderly men, very common. And أنا انصدمت. I was surprised when they told me they don't screen for prostate cancer at all. In fact, screening test for prostate cancer is not done in any of the ayadat, in any of the primary care centers. In fact, people with prostate issues, they just schedule an appointment with a urologist at some tertiary center. For me, this was a red flag. For me, this is a very preventable issue in which we can prevent or reduce the number of cases of metastatic prostate cancer. Like, for example, my father, because when I asked this question to a resident about screening for prostate cancer, I also had in the back of my mind my father, who's 68 years old. I thought to myself that, okay, screening for prostate, this is a routine thing. Or at the very least, they did counseling about prostate cancer and about screening tests, but they did none of this. So most people, they come in advanced cases. They come when they have symptoms. So this was a red flag. I needed to make a research about this. So I presented this idea to a consultant. This idea was family medicine. The previous idea about contrast, this was radiology related. This one is family medicine. So I presented this idea to my consultant. He said, okay, now I needed to validate this research idea. So I had this research idea about the prevalence and the awareness of prostate cancer and screening tests among men, all right, in Saudi Arabia. So this was my question, my idea. I looked up in Google Scholar, I read up the recent articles, I read every article from A to Z, the limitation, the recommendation, and the conclusion, and I came to the conclusion. I had a summary that people in Saudi Arabia, في الرياض, في مكة, في مدينة, في الشرقية, people had very poor awareness about prostate cancer. People had poor awareness about screening tests. And people don't even know the true prevalence because most people, they have poor awareness about prostate cancer and screening tests. So they will not even come to the physician about their prostate unless in advanced cases, metastatic cases. So this is very, very bad. And there were so many research about Saudi Arabia, so many research in Egypt, in Turkey, in Bahrain. So I thought to myself, Nawaf, people already did research about this. However, when it came to deciding the study design, I thought to myself, okay, I cannot do this as a cross-sectional study. However, because there is so many research about this topic in Saudi, في مصر, in Bahrain, in Iran, and so forth, because there's so many research, I thought to myself, let me do a systematic review. We'll do a systematic review. Did somebody else do a systematic review about this topic in the Middle East? No. So now I found my research idea validated and good to go. I wanted to know about the prevalence and the awareness of prostate cancer among men in the Middle East as a systematic review. So did you notice something? Did you notice something familiar in example 2, similar to example 1? I found this idea by encountering something in my life. I found this idea by researching something that came to me. I thought about it, even if the idea was stupid, even if the idea you can Google it by just Wikipedia. It doesn't matter. Research about it. You'd be surprised. For example, I noticed during my family medicine rotation that some consultants, they tell you that some people in primary care centers, they give vitamin B12 in case of diabetic neuropathy. I was like, what? Some people, some residents in general in primary care centers في العيادات, they give vitamin B12 for diabetic neuropathy. Although vitamin B12 has nothing to benefit from in diabetic neuropathy. In diabetes, the problem is in sugar, not deficiency of vitamin B12. I even read about it in research. There was a research in Jeddah, and they found that 50% of physicians, they were prescribing vitamin B12 as the correct choice in treating diabetic neuropathy. So even a stupid idea, even something that you think is impossible, is possible. So anything that you encountered as a student, as someone in general in your life, think about it. Somebody in your gym, he's thinking of using steroids. Muscle dysmorphia. You'll find out nobody did a research about muscle dysmorphia for Saudi. So, I'll do a research about muscle dysmorphia in Saudi. Unfortunately, that's me. I'll be the first one. All right, but I'm giving you another example. People in your gym, people in your family, and so forth. All right. So this is example number 2. Example number 3, and the final one. The final one had to do with the prevalence and the risk factors of falls among diabetic elderly patients. So me as Nawaf, I had another research about diabetes, okay? It was a cross-sectional study, and I was collecting data through questionnaire. I had a questionnaire. I was interviewing people from this questionnaire in real life, face-to-face, and I was interviewing a lot of people with type 2 diabetes, all right? Especially people that were elderly in their 60s. And I found out that a lot of people, when they told me their stories, I found that a lot of them, they told me that they had complications from diabetes, that they would fall on the ground by mistake, and they would have the complication of diabetes. They would have neuropathy, they would have HHS, which is hyperglycemic, hyperosmolar coma, or syndrome, or whatever it's called. So a lot of people with diabetes, when I interviewed them, I noticed that they told me that they fell on the ground at their house and they would be stuck there for like 3 days. They would urinate on themselves. People would come to their house very late and they would come with a lot of complications. So that got me thinking, a lot of people with diabetes, they may fall and they may have complications. But isn't this important to make a research about? In addition, my grandmother, unfortunately, my Habuba in Sudan, جدتي يعني, my grandmother, unfortunately, she had an accident at home. She doesn't have diabetes, but she's very old. She's 80 years old. And she, للأسف الشديد, she fell on the ground by accident. She slipped on the floor. Of course, we went to the hospital, and alhamdulillah, she was fine. But this also got me thinking. That got me thinking about the elderly population. What is the prevalence of falls among elderly population? What is the risk factors of falls among elderly population? I wanted to do a research about this. So I had this research idea. I presented it to the consultant and I said, let me be more specific. I wanted to know, what is the prevalence and the risk factors of falls among elderly patients with type 2 diabetes in Saudi Arabia, all right? So I presented this idea based upon the incident with my grandmother and based on my experience interviewing people with diabetes. Let me validate this idea after asking the consultant for his approval. So I validated this idea. I went through Google Scholar, I found a couple of research articles, and I came with the summary that there is articles done about this, but there had limitations. There was a limitation in the sample size. There was a limitation on the population itself. There was a limitation in collection of data. So I said to myself, okay, these are limitations, and their recommendation is to make a multi-sample size study, a national study about this. So I said to myself, okay, I can make a research about this. I can choose a cross-sectional study about the prevalence and the risk factors of falls among elderly diabetic people, and I will expand my sample size, and I will interview people directly, all right, while addressing the limitations of the previous studies. So if you noticed any research idea, it didn't come from my head. It came from things that I encountered, I researched about it, and I noticed there is a problem that needs to be addressed. So I decided to make a research about this. This is how I come up with my research ideas. All of them are different experiences, and what I want you from the end of this video is to think about your own experiences, research about it, and you'll notice any research idea, there is a specialty related to it. Research, my example number 1 had to do with radiology. Example number 2, it had to do with family medicine, internal medicine. Example number 3, it had to do with internal medicine, rehab, and so forth. So don't brute force your research idea. Think about it. On the internet, anything that you find on the internet on a daily basis, on Twitter, on debate with others, on what you find, on what you encounter in your daily life. Think about it, research about it, and you'd be surprised. You'd be surprised. There is definitely an idea here. It just needs validation, and it's up to you to make a research about it. All right? It's up to you to make a research about the thing that we don't know about. All right? That's pretty much it. I hope you benefited from my way of getting a research idea. You can implement this blueprint and let me know of the results. تمام؟ السلام عليكم.